Struggling to keep up with your prescription drug payments. You're not alone. And now the White House is promising to take immediate action to bring those prices down. Fox News correspondent Madeline Rivera has more for us.
President Trump is making a big push to lower prices on prescription drugs. On Thursday, the president sent letters to the 17 biggest pharmaceutical companies, telling them to deliver immediate pricing relief and sell their drugs to Americans at the same rates they do in other developed nations.
Right now, brand name drugs in the United States are up to 3 times higher on average than anywhere else for the identical medicines.
The letters cite an executive order signed in May that mandates Americans get access to drugs at most favored nation pricing. But the president says he wants to go further and predicted drastic price cuts because he says he's willing to take on big pharma.
We're going to get them down 1,000%, 600%, 500%, 1,500%, numbers that are not even thought to be achievable because I've used a certain talent that I have and convinced the drug companies that you have no choice.
But most of the drug makers say they're already working with the feds to bring down prices, and this type of public admonishment is not helping. Pfizer writing in a statement that the company is, quote, working closely with the Trump administration and Congress on solutions that will increase access and affordability. The White House says this can be a collaborative effort if the drug makers comply with the executive order.
The president expects to further engage with them immediately in good faith to deliver relief for American families.
The president is asking drug makers to start lowering prices by the end of September. In Washington, Madeline Rivera, Fox News.
Thank you to Madeline Rivera. President Trump called on the drug companies and manufacturers doing business to guarantee most favored nation pricing for newly launched drugs and Medicaid within the next 60 days, return increased revenues abroad to American patients and taxpayers, and provide for direct purchasing at most favored nation pricing. What does this all mean? Let's bring in Dr. William Soliman. He's the CEO at Accreditation Council for Medical Affairs. Thank you so much for taking the time here to join us on Live Now from Fox. We do appreciate it.
Thanks for having me.
Well, let's start with this question of most favored nation pricing. What exactly does that mean in the context of all of this?
So basically, for a long time, drug prices in the United States are much, much higher than other nations. And so what President Trump and the administration are trying to do is say, look, that's unfair. We need to make sure that the drug prices that Americans pay are on par with other developed nations. And to be honest, I mean, it makes a lot of sense. Why is it that our drug prices are much, much higher than other countries? And I think ultimately, you know, the intent behind this is very good. I think the challenge is going to be how to actually make sure pharmaceutical companies comply.
Right. And I was going to say this 60-day deadline, that's not a whole lot of time here. So what challenges do you foresee for pharmaceutical CEOs in meeting this deadline set by the president?
So here's the thing, you know, pharmaceutical drug pricing is not like, you know, how you price anything else, right? Within the healthcare system in the United States, we have a very complex kind of matrix with pharmacies, pharmacy benefit managers, the health insurance companies. So being able as a CEO to just quickly reduce pricing without having to work with these other players is going to be a challenge, to be very honest. Now, is it possible? It is possible, but for pharmaceutical companies, especially for the products that are the major drivers of their growth, being able to cut those prices significantly in the next 2 months may be difficult. It may be difficult, not because they don't want to do it, but because there's a lot of red tape, so to speak, that makes it hard.
I want to circle back to our first question because you explained that so well. What does most favored nation pricing mean? Can we discuss a little further here? In what ways do drug prices in the U.S. differ from those in other nations, and why is that the case?
That's a great question. Here's the thing. In the United States, when a pharmaceutical company sets the price for a drug, they actually have to then get that drug on the insurance or the formulary for that insurance company. So think about it. If you have United Healthcare, you have Cigna, Aetna, whatever insurance provider you have through your employer, that drug that maybe you've been prescribed gets put on the formulary and it's tiered. And depending where it is in the formulary, tier 1, tier 2, tier 3, you then pay a specific amount of money known as a copay. But what people don't realize is these middlemen, and President Trump talked about this in his first administration, he's talked about it now to his credit, is we have these pharmacy benefit managers that are the middlemen. And what they do is they get a rebate back basically based on how much that drug costs. So believe it or not, if you're a pharmaceutical CEO, you're actually incentivized to charge more for the drug because in some ways you have to pay more of a rebate back to the pharmacy benefit manager. And so it ends up bringing the price up for everybody. It's just simply put, it's a middleman that's in place that pushes these pharma companies to have to hike up the price.
Yeah, and President Trump called this abusive prices. Those were his words. And I know a lot of Americans feel like these prices could really hit their wallet hard here. So looking towards the future, do you anticipate that this executive order is going to lead to some more healthcare policy reform here or some regulations on pricing in the future?
You know, I hope it will. In the big, beautiful bill, President Trump, again, to his credit, had put in the bill provisions to try to curb some of the powers that the pharmacy benefit managers had, but that was actually not approved. And so I think really in reality, when we look at this particular executive order, he's going to need the support of Congress to actually, get this enacted as a law. Right now, I think some of the things that he may be able to do if the pharmaceutical companies don't comply, he could, for example, put into place some type of mandate, let's say for Medicare, Medicaid, some of the commercial markets, to enforce them to say, look, you need to adhere to this reduced pricing. If you don't, maybe he puts some type of tariffs. Maybe he does something where he allows importation from Canada or other nations that pushes the U.S. companies to have to bring down the pricing. Maybe, for example, he does accelerated approvals for generics. That may push companies, right, to be able to say, okay, look, we don't want to get dinged because we have other generics coming to the market and they're worried obviously about their patent exclusivity. That may push them as an incentive to say, okay, we need to comply with this. So really it remains to be seen. The deadline's, September 29th. Out of all the companies right now, Pfizer is the only company, at least publicly, that said that they're going to cooperate. As far as I know, no other company has really responded back.
You mentioned Medicaid, and I know when we were covering the big, beautiful bill, that was a big talking point there from the Democrats. And you spoke on this a little bit, but can we talk a little bit more about Medicaid? How is this going to impact those who use Medicaid, who are on Medicaid?
Yeah, so I mean, ideally, if President Trump is able to get the pharmaceutical companies to reduce pricing, it's going to be a plus to people that are on Medicaid, that are on Medicare. Both sides of the fence, they're going to benefit from this. And I think, if you think about it, if you're an older American, a senior, 65 and older, you're on multiple drugs. So, it really hits your pocket hard if you go to the pharmacy, you're taking 3 or 4 drugs and you have to pay an exorbitant cost. Being able to bring the price down as to what it is in other countries really can help. So again, the intent behind the order, I think, is fantastic. I think what he's trying to do to reform the healthcare system is great. Really, if you think about it, in the last 20 or 30 years, no one's really gotten this far in being able to really push pharmaceutical companies, hold them more accountable when it comes to drug pricing.
One of my last questions for you here, talking about different stakeholders, including patients, healthcare providers, insurance companies, how are they likely to respond to this executive order? What are your predictions and thoughts here?
Well, it depends, who the stakeholder is, right? Again, for a pharmaceutical company, if they didn't have these, systems in place with these middlemen, I actually think that many of them would be happy to be able to lower the price. I think the problem, again, is the fact that you have the pharmacy benefit managers that's role really, from my perspective at least, is not that beneficial to the patient. I would actually say it's detrimental. So I think pharmaceutical manufacturers and the CEOs want to do the right thing. Despite all the negative that you hear about big pharma, many of the leaders are really trying to do the best they can to minimize the high cost of drugs. So it remains to be seen, but ultimately I think the intent behind the bill is right. Let's see what happens, and let's see whether the pharma companies comply.
You're right. Let's see what happens. We'll continue to follow this story. Thank you so much, Dr. Soliman, for joining us this morning. Great discussion.
Thank you.